Knee replacements were once considered routine operations, but the British Medical Journal says that in England they're increasingly being rationed. The journal obtained data showing a sharp rise in doctors resorting to special appeals to get these and other once routine treatments for their patients. Our health correspondent Dominic Hughes reports.
Helen Herity is a busy woman. Running her boutique hotel is a demanding job. But when her eyesight started to fail, Helen needed a cataract operation. Imagine her dismay then when she was told the NHS would only pay for one eye to be fixed at a time.
I just didn't want to wait another year and sort of have one eye, and the imbalance it causes, it's difficult, and it really impacted on my life. You know, I have to be busy, I have to be able to see, actually, just to function here.
A growing and ageing population is placing increasing demands on the NHS. That, in turn, is ramping up the pressure on finances. So, to save money in some areas, funding for common treatments is being withdrawn. When that happens, GPs can make individual requests on a case-by-case basis. A BMJ analysis shows overall these have increased by 47% in the past 4 years. There's also been a big rise in requests for hip and knee operations over the same time period. And the number of cataract operations for which funding has been sought has also gone up.
Sure, we can do that today.
Decisions on which NHS services are funded in England are made by local clinical commissioning groups. The national body that represents them says that given a limited budget, they're forced to make difficult choices.
Demand goes up, the population ages, and the funding of the NHS is a finite amount. We have to make those decisions. If there was more money in the system, clearly we could have a broader sense of how we spent that. But actually, with loads more money in the system, we should still be making appropriate clinical choices for the patient.
But doctors say all health leaders need to be honest with patients about the decisions they're having to make.
Year after year we've seen a lack of investment, and so local areas are having to make these really difficult decisions and ultimately, in many areas, rationing services.
Today's report suggests more and more patients are finding procedures that were once considered routine are becoming harder to access. Dominic Hughes, BBC News.
Students from poorer families in England will graduate with nearly £60,000 of debt, according to a report by the Institute for Fiscal Studies, because interest rates on student loans are now at over 6%, and those from